Good morning. For those of us who are in recovery from alcohol or drug use, it's important to recognize that relapse and the events leading up to a full-blown relapse uh, have a typical pattern that they follow. And there's been a lot of research done to identify key components of that pattern and what's common between people who have been in recovery and have relapsed to alcohol or drug use. So again, we're looking at Staying Sober, a guide for relapse prevention by Gorski and Miller. And I'm going to read some about what they found and about Terence Gorski's research into the patterns of relapse and how he defines it. So they say, the relapse process causes the recovering person to feel pain and discomfort when not drinking. This pain and discomfort can become so severe that the recovering person becomes unable to live normally when not drinking and feels that taking a drink cannot be any worse than the pain of staying sober. 37 warning signs of relapse were identified in 1973 by Terence Gorski through the completion of clinical interviews with 118 recovering patients. And these patients had four things in common. They had completed a 21 or 28-day rehab program for alcoholism. They had recognized they were recovering people and could not safely use alcohol or drugs. They've been discharged with a conscious intention of remaining permanently sober by using both Alcoholics Anonymous and professional outpatient counseling, and they had eventually returned to drinking despite their initial comments to remain sober. So Gorski then took all of the comments that he got from this interview and he distilled them down into 10 phases of relapse. Of the relapse process. And most of these phases are phases that are happening before someone picks up drugs or alcohol again. So this goes back to the idea that a relapse is something that happens long before we actually pick up booze or alcohol again and start to use again. So today we're just going to go over the first two phases. Because there's a lot here to talk about. So phase one is internal change. During this phase, I look good on the outside, but I start using old addictive ways of thinking and managing feelings that make me feel bad on the inside. The most common relapse warning signs are: 1. Increased stress. I begin to feel more stress than usual. Sometimes this is the result of a problem or situation that is easy to see. At other times, it is the result of little problems that cause stress to build up slowly over time. So I'm going to stop right there, because this is where I've been the last few weeks especially. And I have felt stress pulling me into these old ways of thinking. And because of what I know about recovery, I've been able to recognize that what's happening is, 1, it's not good for me, and 2, that it was up to me to do something to change it. And so I've made a couple of small lifestyle changes in terms of the amount of exercise that I'm getting, and in terms of, for example, the diet that I have. I've just continued the recovery program that I have. I've also got an appointment with a counselor to talk about what I've been going through, and you try to use some cognitive behavioral therapy techniques to deal with some of the things that have been going on with me at work that have been contributing to my stress. And so it's really important that we know all of this stuff so that we can recognize these symptoms when they come up and then actually do something about them. But that's just part of this internal change phase. So let me keep going. Change in thinking. I begin to think my recovery program is not as important as it used to be. Sometimes things are going so well, I don't believe I need to put a lot of effort into my program. At other times, I have problems that my recovery program doesn't seem to help, and I ask myself, why bother? Change in feeling. I start having unpleasant feelings that I don't like. Sometimes I feel euphoric, like everything is going my way when I know it really isn't. And at other times I feel depressed, like nothing is working out. I know that these mood sweeps are not good for me. I've experienced a little bit of that recently. Not as extreme as what they described there, but definitely experienced some mood swings that I felt were the result of some of the stress and mismanagement of that stress that I've been dealing with. Change in behavior. I start acting differently. I still look good sound good on the outside, but I know deep inside that I'm not practicing my program the way I used to. Deep inside, I know something is going wrong. So then we get to phase 2, which is denial. And during this phase, I stop paying attention to or honestly telling others what I am thinking and feeling. The most common relapse warning signs in this phase are worrying about myself. I feel uneasy about the changes in my thinking, feelings, and behavior. This uneasiness comes and goes and usually lasts only a short time. Sometimes I feel afraid that I won't be able to stay sober, but I don't want to think about it. I can't identify with this one. I have not felt this one recently. Nothing that I've been feeling has made me feel like I am concerned about being able to stay sober. But I think part of that is that I've recognized that these feelings that I'm having are something I need to do something about them. To the second part of this is denying that I'm worried. Maybe I just did that. I don't know. I don't think so, but let's see what they say. I deal with this uneasiness in the same way I used to deal with my addiction. Go into denial and try to persuade myself that everything is okay when it really isn't. Sometimes the denial works and I can forget my problems and feel better for a while. I definitely haven't done that. I usually don't know that I am using denial when I am doing it. It is only when I think about the situation later that I am able to recognize how bad I was feeling and how I denied those feelings. So yeah, I have definitely not denied my feelings recently. In fact, I've gotten caught up with them a little bit more than I should, which is one of the reasons why I felt like I needed to get exercise and healthy eating back into part of my recovery. Because I had been ignoring those things, and I know that when I eat well and when I exercise, it's easier for me to cope with feelings that are natural for people to feel. So none of this is here to say that we shouldn't feel stressed sometimes. We're going to feel stressed sometimes, and that we shouldn't feel bad sometimes or sad sometimes. We're going to have those feelings, and those feelings are okay. So denial is very different than acceptance, and we have to remember that. And sometimes those things can look confusingly similar, but accepting that I feel a certain way and accepting that either there's something I can do about it or I just need to feel what I'm feeling is a lot different from denying that I feel that way in the first place. I feel like I've been in the first category recently. I have accepted the way that I feel and also accepted the fact that for me to stop feeling that way, I have to do something about it. So, like I said, these are just the first 2 phases, and there's 8 more to go through. So I'm going to go through these phases over the next few days. And the reason that I think it's super important for us to know all of this and to understand all of this is because we want to be able to see this stuff in ourselves when it starts coming up, so that we really have a better idea of what we need to do to make sure our program is intact, that our recovery is solid, so that when we end up in these phases, because I'm willing to bet for almost everybody who's watching these videos, they're going to identify with some of the phases that we describe here. And we need to be familiar with them so that we know what kinds of things we need to do. So, hope this is going to be helpful for some folks. I know just knowing that some of the things I've been going through are natural parts of recovery, and that there are things I can do about them, has been helpful for me. So I will be back here with phase 3 and maybe phase 4 and 5 tomorrow morning. Have a good day.